Hi, everybody. My name is Shambhavi Sinha, and I am a rising junior at Elderville High School in Texas. Today, I will be shining some much needed light on the topic of air pollution's impact on neurological health and social equity. To introduce myself and dive into some of my interests, my passion lies in areas grounded in research and service. I am currently a research intern at the Perot Museum's collection departments, where I work alongside a PhD student on a dissertation studying heavy metal exposure in birds to track long term air pollution. I'm also a founding member of Backpack for Asia, where I've directly donated over $800 to school boards across Asia and have provided 40,000 rupees worth of blankets to the homeless during the winter season in India. For leisure, I love using art as a tool for health and environmental advocacy, along with training in karate as a second degree black belt. Looking ahead, I truly hope to pursue a career in biomedical sciences to build solutions that improve lives on both the cellular and societal level. To start off with the cake, let's talk about something invisible, yet leaving behind one of the most visible consequences. Air pollution doesn't always come with thick smoke or a foul smell. In fact, some of the most dangerous particles like PM 2.5, ozone, and nitrogen dioxide are completely invisible to the eye. But just because we can't see them doesn't mean they aren't hurting us directly. According to the World Health Organization, over 7 million people die prematurely every year from air pollution related causes. That's more than malaria, HIV, and tuberculosis combined. So today, let's talk about making the invisible visible. Now, we usually think of air pollution affecting our lungs or heart, but research shows it can go much further. More specifically, all the way up to our beloved brain. In this diagram to our left, we can see how tiny pollutants like PM 2.5 are so small they can enter the bloodstream via our lungs, cross the blood brain barrier, also known as BBB, which is essentially a highly selective, semi permeable border of tightly packed cells lining the blood vessels in our brain. And the two circle images represent this with more visual depth. And then this can trigger neuroinflammation. Now, this inflammation has been linked to many negative health effects displayed in the table, like cognitive decline, memory loss, depression, anxiety, and even neurodevelopmental issues in children. In fact, emerging studies also suggest connections between long-term exposure and increased risk of conditions like Alzheimer's disease, which is extremely serious and should be handled with caution. While air pollution affects everyone, it doesn't affect everyone equally. Low-income communities and children of color are more likely to live near highways, factories, or waste sites, where pollution levels are much higher. Schools in these areas often have poor ventilation, old infrastructure, or no air purification systems at all, making indoor air just as dangerous as what's outside. As presented in the slide, you can see how an estimated 41% of districts need to update or replace heating, ventilation, and air conditioning systems in at least half of their schools, representing about 36,000 schools nationwide that need HVAC updates. This further reinforces the unequal circumstances and conditions present across our nation. This can lead to higher rates of asthma, chronic absenteeism, and even lower academic performance, all caused by the air students are forced to breathe. And in many cases, these communities are the least responsible for creating the pollution, but are often the ones that face the most serious health consequences from it. And as we can see in this visual representation, there is a correlation in the color density between the two maps, represented by the circles, indicating an on average exacerbated air quality for children of color. In the face of all these predicaments associated with poor air quality, what can we do? One powerful answer is citizen science, where everyday people, especially the youth, collect and share real data about the air around them. From using low-cost monitors to track AQI in classrooms to building DIY centers in cities like Delhi and Oakland, citizen science puts knowledge and action directly into the hands of our communities. This slide just represents a few instances of communities coming together to solve these air pollution-related problems. Now, just having talked about how our community can help in terms of air pollution, I myself have also had the opportunity to be part of this greater solution. As a research intern at the Pro Museum Collections, I analyzed pollution trends by studying lead levels in bird specimens using an X-ray fluorescence machine. These birds serve as bioindicators, helping us understand where heavy metal pollution is accumulating and how it changes over time, thus allowing us to make advancements when applying this knowledge to our current world with human beings. Outside the lab, I am the team lead of a community initiative called the Breathe Well campaign, where we receive a stipend of over $3,000 to help address air quality in under-resourced areas. Our campaign focuses on distributing Breathe Well bags filled with activity charcoal, seed kits, and multilingual educational brochures to families in vulnerable areas. Alongside this, we've dedicated time and effort to facilitating the donation of high-quality air purifiers to schools across the country. With my regards to my creative side, I've also created air purifying paintings using charcoal and base materials and giving them to libraries or educational centers. And I share all of this not to show what I've done, but to remind you that anyone, especially young people like us, can step up, get involved, and make a real impact in their communities. Now, we've covered quite a lot today, from how air pollution quietly affects our brain to how it deepens social and educational inequalities, and how youth led, community based solutions are stepping in where traditional systems fall short. But more than anything, I want to leave you with this: air pollution might be invisible, but the damage and the opportunity to act on it is incredibly visible. Whether it's distributing air purifiers, building DIY filters, planting clean air greenery, or simply starting a conversation about poor air quality at your school, change doesn't require a lab coat or $1 million budgets. And the impact of this change connects directly with global goals like SDG 3 for health, SDG 10 for reducing inequality, SDG 11 for building sustainable cities, and SDG 13 for taking urgent climate action. Check your local AQI, share educational materials, volunteer with environmental groups, join citizen science networks, and if one exists, create one. Because at the end of the day, it's not just about air, it's about the people and global health. Here, I have listed my references for any pictures, information, or quotes I have used throughout the entirety of this presentation. And right before I officially close, I would like to take a moment to thank the people who have supported me on this journey. First, thank you to Global Health Leaders Conference at Johns Hopkins University for creating this platform to uplift your youth voices and drive meaningful conversations in public health. To Dr. Shannon Bay, thank you for mentoring me through my internship at the Pro Museum. Thank you as well to Carnegie Young Leaders for believing in youth-led innovation supporting our Breathe Well campaign. And finally, thank you to my family, teachers, and friends for your encouragement, as it has fueled my passion every step of the way. And lastly, of course, thank you to all of you guys watching this video, and I truly hope I was able to shine some light on a topic where you all can create a tangible impact. And if you ever have any questions at all, please don't hesitate to reach out to me via email, and thank you so much for your time today.